Health Watch, measles cases in the U.S. have hit numbers not seen in a quarter century. Health officials said 19 years ago, measles had been effectively eliminated in the country. But this year, more than 600 cases have already been confirmed in 22 states. New York is battling the largest outbreak in the country. The state has seen at least 61 new cases in the last week. CBS News chief medical correspondent Dr. Jon LaPook has more.
More than 80% of the New York City cases have occurred in Williamsburg, Brooklyn, among unvaccinated members of Orthodox Jewish communities. The New York City Health Department said the city's measles count is now 390, up from 359 just last week. That includes 2 pregnant women. Neither is hospitalized.
We are really concerned.
Dr. Ann Schuchat is the deputy director of the CDC.
Some of the outbreaks are not yet under control, and so I do expect the numbers to rise.
There have been other outbreaks, including Washington State and this week in Los Angeles County. 2 weeks ago, the New York City Health Department took the unprecedented step of issuing an emergency order requiring anyone in Williamsburg over the age of 6 months to receive at least 1 dose of the measles, mumps, rubella vaccine or have proof they've already been immunized.
I hope parents realize that measles can be serious, and making sure their children receive this safe and effective vaccine is important.
Dr. Jon LaPook joins me now. Dr. LaPook, why are we now seeing these pockets of people that just don't want to get vaccinated?
Well, you know, this has been a movement that's happened over the last 20 years where more and more people are deciding not to get vaccinated. I mean, I was out in Texas 10 years ago, 10,000 people were having exemptions from getting vaccinated for childhood vaccinations. That's up to 50,000. And the consequence of that is a disease that we thought we had gotten rid of is now roaring back.
Higher numbers than we've seen since it was eradicated, which is astonishing.
Yeah.
How do we convince people to get their children vaccinated? Why is it so important? What's your message?
Well, why it's so important is easier than how you convince them to get vaccinated. Why it's so important is there's a concept called herd immunity. And herd immunity means that if enough people get immunized, it not only protects the person who's immunized, it protects people who are not able to get immunized. So people need to understand, parents need to understand, when they decide not to vaccinate their child, they're not just rolling the dice for their own child. They're rolling the dice for other people, for babies under the age of 1. That's too young to get immunized, generally, for people with cancer, people with immune deficiencies, and for pregnant women. We saw just today 2 pregnant women have come down with measles, and that can be serious during pregnancy.
How serious could it be for the pregnant women and for their unborn child?
Well, you can have pneumonia, and there have actually been deaths for people who have been infected women have been infected during pregnancy. It could cause some prematurity. So far, there have not been birth defects that have been shown, to occur. They do occur, including deafness with rubella, which is German measles. So it's confusing to people. What's measles that we're talking about is called rubeola in med speak, and German measles is rubella. And that MM in the MMR vaccine is measles, mumps, and then the R is rubella, which is German measles.
What is the CDC saying? Are they worried about these numbers continuing to rise?
Absolutely. And I think, right now, this herd immunity number is still over 90%. So we're talking about pockets of people. And when they said it was eradicated back in 2000, it was in the United States. But what's happening is the world is so much smaller now, Nikki, right? So people go abroad and they get infected. If they're not immunized and they're not protected, they get infected elsewhere in the world. And they come back and then they bring it with them. And measles is so infectious. There's a concept called R0, which means how many people will one person infect? Well, the R0 for measles like 12 to 18.
Wow.
The R0 for Ebola was about 2. So this is just about the most infectious thing, and the virus can hang in the air for a couple of hours after somebody leaves the room, and you can also be infectious before you even have symptoms. So this is something that spreads like wildfire.
And I know you've said, don't just think about yourself, think about others, think about other children, get the vaccine, protect others and yourself. I think a question a lot of our viewers probably wonder, as do I, as someone who's had a measles vaccine, how likely am I to contract measles?
It's very effective. Once you've had 2, it's way over 90% effective, and the immunity lasts for decades and decades. I mean, occasionally it can wear off over many, many decades, but it's one of the most effective vaccines we have. You should see, Nikki, I'll show you the graph, right? There's all these cases of measles, and then boom, in the 60s, when that vaccine comes, it just drops off. And people forget, it's not just measles, it's polio, it's other things that we've all taken for granted. And I actually am old enough to remember people coming into the hospital who had polio, and they were put in these drinkers, these kind of iron lung machines. I mean, it's devastating, the side effects from that. I've heard it said that aside from clean water, nothing has been more important for public health than immunizations.
Wow. What needs to be done to end this current outbreak?
I think it's education. I mean, do you remember those things when you were a kid that you put your finger in, and if you tried to pull, they wouldn't come out? You had to push in order to then loosen it up. I think it's that. It's that we can't do it by force. We have to do it by education, by you're not going to coerce.
Listening to Dr. LaPook.
By listening, but also by understanding, where you can get information. I think one of the big problems has been social media, the internet. If people, depending on what the Google term you use is, if you Google vaccines side effects, you're going to see a lot of bad things, and including a lot of things that are not true. If you say vaccines debunk, you're going to see a whole different literature. So I think it's up to us to be aggressive in terms of educating. And I think our public health officials are starting to realize they need to be more aggressive than they've been. They have taken some criticism over this, and I think they need to just get out there, including our government officials, and say, hey, look, you should go get vaccinated.
It's interesting. I think when the public hears Ebola, their eyes bulge and they're fearful, and they hear measles, they're not so alarmed. But really, you've just said measles is so much more contagious than Ebola, which is really interesting.
Much more contagious, and it's potentially deadly, and we've kind of gotten blasé to it. We need to understand this is an important disease that can cause important illness, and my heart really goes out to people who are not able to get vaccinated. Well, certainly the babies, who you normally don't give the vaccine till age 1, for people with immune-compromised systems, for people who have cancer, and they are relying on that. They're relying on that herd immunity, and I think people need to be responsible and say. I mean, it's always hard to think that way. Well, I want to protect my own child, but you have to protect society as well.
Dr. LaPook, thank you for educating us.
Nikki, nice to be here.
Thank you.